Well, Hawaii's Department of Health has reported a dozen confirmed cases of the new Omicron variant on Oahu. That's just one of 30 mutations, though. And as more cases of Omicron are being found here in the state, healthcare providers are now reporting a surge in demand for COVID tests. KITV4's Eddie Dow joins us live at one clinic that's seen a 50% increase over the past 2 weeks. Eddie?
Good morning, Maleko. I am here at Premier Medical Group Hawaii with our friend Dr. Scott Mishkovich. You know, Dr. Mishkovich, one thing that changed, I mean, you were on the front lines of testing. You ordered the supplies before we even knew it was coming to the United States. We think that this was spreading in China 2 years ago. This is what testing looked like in the beginning, this nasal swab, right?
That's exactly right.
What is it? It has really evolved to all of this over here. Can you walk us through what we're looking at and all the different testing options now available?
Sure. I mean, the first thing I do want to say to everyone is this still is the gold standard. If we really want to know if you have COVID, then this going back deep into your nose, back into the nasopharynx, sent to a big quality lab that runs it on a $100,000 machine for one little test, that's where you know. But over here, you're going to see this is where we've developed. Number one, this is a rapid antigen test. This is the one we used and was chosen for the U.S. Olympics. So very accurate. It can come up to 90-some% accuracy on the first time. That also has a development where it actually can do flu at the same time, which is something we try to do to differentiate do you have COVID or flu. So that's also. Now, when you get to a facility and all you have is something that looks like a little rapid pregnancy test, you know, it's kind of a little bit buyer beware because those start losing accuracy. You're not going to get what you need you may be in the 70 percentile.
Those look like the home test.
Yeah, and the home test, actually very good. The home test, very important to highlight. Why do they come in a 2-pack? Well, they come in a 2-pack because they are so inaccurate that they are designed to be done test on day 1, day 2, or day 1, day 3. They are not to be done one time to prove you're clear because they are so low in accuracy.
Dr. M, you told me 50 to 70%?
Yeah, if you do one test and you're asymptomatic, you're probably in the 50 to 70% range of catching. Now, you go down here.
All right, we got one more.
Sure, you may be seeing these tests. These are rapid PCRs, and this is the one we use for the Olympics. It takes you way up into the high 90s. So there are tests that can be done within 30 minutes, but the key is to get a test done at the lab if we know it's Omicron, so it can be sent to the Department of Health.
All right, well, thank you so much for joining us, Dr. M. And just want to stress, Dr. M says that they all test for COVID, but to know if you possibly have the Omicron variant, it can't be a rapid test. It would have to be those that give the results in a couple of days. Reporting live in Kaneohe, Eddie Dowd, KITV4 Island News.